Hello, I'm Carsten Floor. I'm a consultant dermatologist at Guy's and St Thomas's Hospital in London, and I lead a multi-centre study for children with severe eczema. Why do we study severe eczema? Well, severe eczema is a debilitating condition, mainly because of the intense itching it causes, constant scratching day in, day out during the night. Children can't sleep, they then can't concentrate at school, and in older children and adults there very often is social withdrawal, anxiety and depression associated with severe eczema as well. In patients like this, the conventional steroid creams and emollients and even light treatment don't really work, and we have to resort to tablet treatments. Cyclosporin and methotrexate we've used for many years in severe eczema, and we know that they work, but we don't know which one is better. And that is why we're doing the TREAT trial. TREAT stands for Treatment of Severe Atopic Eczema in Children trial. Although we've used cyclosporin and methotrexate for many years, we don't know which of these two treatments is better. And in the TREAT trial, we are not just looking at how the medicines impact on the disease severity, we're also very interested in studying the impact on quality of life. We very carefully look at their safety profile, so the adverse events associated with taking these medications, and we are going to do a cost-effectiveness analysis. And finally, we would also like to know how the child's immune system responds to these drugs, both in the skin and in the blood.
We're into the 18th week now of the trial, so we're more than halfway through, and the time has gone quite quickly. Her skin was very bad. She suffered from severe itchiness, flakiness in the mornings, removing her nightwear, the skin would just fall away in flakes. Yeah. It was sore, bleeding on most days, and the eczema covered from sort of her forehead all the way down to her ankles. So it was quite severe before we started. So Summer, do you remember what your skin was like before we started the medicine?
It was very, very bad.
And how was it bad?
Well, I was bleeding a lot, and there was lots of scabs and lots of cuts.
And how did that make you feel?
Sad.
Due to the lack of sleep or disturbed sleep, she was quite irritable, and the lack of sleep also had an effect on myself as a parent and her carers. Irritability, mood swings that you wouldn't expect in a child of her age, because she didn't know how to control the way her body was reacting to the itchiness and to the soreness. So it was quite difficult. She wasn't a happy child that she should have been at her age, because day-to-day living focused so much around dealing with the eczema and caring for her skin. So the impact on her was quite negative. I had reservations before we started. It seemed quite daunting, but since we started, it's been quite positive. The contact that we have with the team, whether it be via telephone, via email, they're always on hand if you have any concerns. Scheduling the appointments, especially in the early days where the appointments were quite close together, but they were quite supportive in trying to schedule the appointments according to your schedule, and obviously because she's at school, the times that we were given were quite flexible, and they always tried to be as quick as possible without feeling as though you've been rushed through all the procedures that you have to face when you're visiting the team. So on the whole, I would say it's been a positive experience. The very first time, I suppose because it was all unfamiliar to her, she was a little bit concerned, but the worst thing for her was the blood tests, and that's just because she doesn't like the sight of blood. Yeah. But the tape stripping, the blood pressure, those things she found okay to deal with.
Patients take the trial medicine for 9 months, and the medicine's assigned at random, so you don't get to pick and we don't get to pick which medicine the child gets, and this is so that we can find out which of the medicines is best. Children take the trial medicine for 9 months and are followed up for a further 6 months after this, so children are in the trial for 15 months altogether. The visits are quite frequent at first and then they spread out, and this is so that we can keep a close eye on patients that are taking part in research and make sure everything's okay. There are lots of things in TREAT that are the same as normal care. For example, any Any person taking a tablet medication for their eczema needs to have regular blood tests to check that everything's okay and that you're taking the right amount of medicine. When you have a blood test, we also take a bit of extra blood for research, and this is to check for things like if you have a certain gene that makes you more prone to getting eczema. As well as blood, we ask children to give us a wee sample. We listen to the child's chest and do blood pressure and height and weight. And we also do something called tape stripping, where we place a little disc of plastic on the skin and peel it off, and then we can look at the skin under a microscope afterwards.
Downside for her is the blood tests, but the upside for a carer is that you know she's been closely monitored. So any slight changes in anything's picked up very quickly. And also being on hand in terms of telephone or email contact is very useful. So you always feel as though you're never alone. There's always somebody there to give you information or support or guidance all the way through. So that's a positive thing. And how is your eczema now?
It looks very, very better.
And how are you feeling about it now?
Happy.